Okay, I'm Angie. I am going to do an intramuscular video and I am going to show a proper injection. So first I want to begin with my hand hygiene. Open my MR. And it looks like the medication is naloxone, 400 micrograms, IM stat. Unlock my cart, locate my medication, which is my first check. Second check against the MAR, naloxone 0.2 milligrams. Okay. From there, I want to gather my supplies. My alcohol pad, a syringe, and my needle, a 23 gauge needle with a 1 inch, since it is an intramuscular injection. Okay. So, alright, so being that it's in micrograms, I want to do a drug conversion to switch it over to milligrams. So it looks like I will give 2 milliliters of my naloxone. Prep my bottle. I'm going to open up my supplies in a sterile fashion. Draw some air into my syringe and cap it. So now I'm going to inject my air, invert, and draw out 2 milliliters of my medication. And I want to make sure to tap out the air bubbles. Now I will put my cap back on using the scoop method. Okay. So before I go into the patient's room, I do want to look up my drug. It states here that naloxone is used for CNS depression and respiratory depression. You know, I am to perform vitals before giving the medication. You know, I want to check my respiration, BP, pulse, O2 stats before administrating. I want to do my third check in replacing the medication. Okay, naloxone, 400 micrograms. Okay. So I want to gather my supplies, lock the med cart, and head into the patient's room. Okay, upon entering the patient's room, I'm going to provide privacy. I'm going to perform my hand hygiene. Hi, I'm Angie. I'll be your student nurse for today. Can I get your first and last name and date of birth? Okay. Do you have any allergies that I should know? Okay. I'm just going to check your wristband. Okay. All right. Thank you. Okay. Now I want to make sure to get the patient's bed into a working position. There we go. All right, Mrs. Jones. So today I am going to give you an intramuscular injection in your ventral gluteal site, which is the right, the side of your hip. And before I can do that, I do need to do some assessments. So I need to check your respiration rates, your blood pressure, your temp, and your pulse before we can begin. Okay, so do my assessments. Okay, so it looks like everything has checked out. Do you have any questions before we begin? Okay, all right, so before, I'm going to put on some clean gloves before I start my injection. And I want to locate my landmarks for my injection. So because it is in the ventral gluteal, I need to locate my iliac crest, my greater trochanter of the femur bone, and my anterior superior iliac spine. Right there is, right in the middle where my hand is where I will give the injection. So Before I do it, I want to prep the skin with the alcohol pad and let it air dry. And it is going to be an intramuscular injection, which I will be using a Z-Track form to do so. So I'm going to pull back the skin. Excuse me. I want to pull back the skin to do a Z-Track, and I want to go in at a 90-degree angle. Before I inject, I want to aspirate the needle to make sure that there is no blood, and I will inject the medication at about 10 seconds per mil, so about 20 seconds. So 18, 19, 20. There we go. And I want to put the safety on the needle, place it into the sharps container. Alright, so are you doing okay? Good deal. Okay. After my injection, I want to perform my hand hygiene. The bed is in low position, room is free of clutter. I want to ask my patient if there's anything else I can do for them. My name is Angie, and I'll be here for the rest of the day. So if you need anything, please don't hesitate to call. So from here, I want to go back to my book. So now I want to document in the MAR date, time, initials, and site. Okay, that's completed. So that is my intramuscular medication video.